Welcome to the Consortium of Universities for Global Health's ongoing Global Health Leaders Series. I'm Dr. Keith Martin, the Executive Director of CUGH. The Centers for Disease Control and Prevention is the world's leading and most respected public health institute. It has saved millions of lives here in the United States and around the world. Yet of late, we've seen a great deal of, frankly, bashing of the CDC, a great deal of disinformation about it, deep cuts to its personnel, as well as to its programs. These have consequential effects on all Americans. And what we wanted to do is to be able to share with you, what does the CDC do? Who are the people there? And how is it and why is it important to every single American and frankly for people around the world? And I can think of no better person to do this than to have Dr. Tom Frieden, who was the director of the Centers for Disease and Control and Prevention during deeply consequential times. He was also the health commissioner for New York City, and he has led efforts that, again, has frankly saved millions of lives across a broad range of areas. And I'm not going to spoil it for you because Dr. Frieden is here to tell us about that. But Dr. Frieden, thank you for making the time to be on this series, and it's wonderful to see you again. So thank you.
Thank you, Keith. I'm really looking forward to the conversation and to speaking with your listeners.
Great. And we have a book coming out tomorrow that we're going to get into shortly. But I think the first thing is for anybody, tell us a little bit about your story. Why did you get into public health? You're a physician. You had a broad range of deep expertise in a lot of areas. Why did you get into public health, and why did you join the CDC?
It's interesting. I can remember the first time I heard of the CDC. It was in 1976, and they had cracked the case of the Legionnaires outbreak, and it was front page news. And my father, a cardiologist, was reading it at the breakfast table and said, that CDC, they're pretty good. And I went to medical school with the idea of going into public health. I did MD, MPH during medical school. I did internal medicine residency in New York City at the height of the AIDS epidemic when I cared for hundreds and hundreds of people. And this was pre-AZT, pre-highly active antiretroviral therapy. And really, I had hundreds and hundreds of patients who I could only help die more comfortably. It was a horrible, searing experience. Um, I then did the Epidemic Intelligence Service at CDC, the Disease Detective Program. And as it happened, I did that during a time of a big outbreak of multi-drug resistant tuberculosis in New York City. So I led the investigations of that as a CDC EIS officer. And we found out it was spreading in hospitals. That was the driving force. I joined CDC as a staff member and as the Assistant Commissioner for Health in New York City and Director of the Bureau of Tuberculosis Control. We had very rapid control of tuberculosis in New York City, really as a reflection of the fact that so much of the cases were recently spread. So when we turned off the tap, cases just plummeted, an 80% reduction in just a few years. And then I had always wanted to work in global health. I had the opportunity to go to India to work with the government of India, the states of India, on a World Bank funded project under the aegis of the World Health Organization. So I actually was seconded to the World Health Organization as a CDC staff member and spent 5 years in India. That was a wonderful experience. It went well. We were able to expand effective programs. Much more always to be done on tuberculosis, but many things went well. And then I got asked to become New York City Health Commissioner. So I went back to New York City with literally the rubble of 9/11 still burning, and was health commissioner under Mike Bloomberg for nearly 8 years. We were able to do a lot on tobacco and HIV and data systems, even in primary care. And then President Obama asked me to become CDC director, which I did for 8 years also. And now for the last 8 years, I've been leading Resolve to Save Lives.
I mean, in the many things you said there, one of the striking things was that people wonder what's the role of multilateralism. Your work with the CDC, the WHO, the World Bank, that integrated relationship really spoke well as a partnership to save a lot of people's lives. And I think it speaks to the power of multilateralism. And to that end, you just wrote a book, and the book is The Formula for Better Health: How to Save Millions of Lives. Why did you write the book? Yes.
Oops, up with
Pull it
this
back a little
virtual
bit.
background, it doesn't work. But anyway,
Yeah.
let's see if it
Maybe a little
works.
bit. No, pull it back towards you a little bit, maybe.
Let's see.
There you
There we
go. That's
go.
it. That's it. Yeah.
Anyway,
There you
the
go.
formula for better health. I've spent a decade writing this book. I started during the Ebola epidemic of 2014, 2016, when it became really clear to me that many people don't understand what public health is. They don't understand why it's important and how to support it. And within public health, we can do better to succeed. So I wrote this book. I hope fundamentally it will help save lives. That's the guiding principle by which I decide what to work on. And what I realized in this 10 years of writing is that there is an approach, I call it the formula, that underlies successful public health programs. It is to see, believe, and create. See the invisible. And that's really the public health superpower. See the things that aren't apparent, but make a huge difference, whether it's microbes or toxins or trends or program performance or the rigorous path to progress. But that's not enough. You have to believe that progress is possible, and that means building confidence. And then that's not enough either. You have to be really strategic and create a healthier future through very organized, focused approach with organization, simplification, effective communication, and then overcoming the barriers that make public health progress so difficult. And then I apply that to say, what would that look like to create a world without pandemics or with no deadly pandemics? And what would that look like in individual health? How do we use epidemiologic wisdom and epidemiologic reasoning and insights to cut through the hype, the grifting, the sloppy thinking, the profiteering, and say, what are the things that actually work to help people live a long, healthy life? And how much benefit is there from each of these things? And what can we do to reduce the risk of dementia? Because that's such a devastating problem. It's supposed to be, and I hope it will be, not just a message of hope that we can make a lot of progress, but also a message of how. Here's how to succeed.
And I think on the website for the book, you you gave presented a rhetorical question. You said, "What's the biggest threat to public health?" And it's perhaps not what people think. So I'll turn it back to you, Dr. Frieden. What's the biggest threat to public health?
I think the biggest threat is the lack of recognition and support that public health is what we do as a society to live longer, healthier lives. And we in public health can make a big difference by listening better, by communicating better, by winning, by having successes in things that people care about and showing those successes so they're more apparent, and by creating a healthier future together.
How do we communicate that better? Because in this era of disinformation where it's been such a threat to the work that we all do, it's sometimes feels like a bit of David and Goliath in that environment that it's tough to fight against it. So what do we need to do better as global health professionals to communicate what we do in a more impactful way, not only to policymakers, but to the public?
I think we have to start with listening, right? Good communication starts with listening, hearing what people are seeing, what people are understanding, what they're concerned about, and then crafting messages that work, working with messengers who can be listened to, who can be heard, figuring out the right time, and understanding that messages change over time. In public health, we have to be faster. We have to be more impactful. We have to be better at listening and communicating. We need to strengthen our alliances. I talk in the book about um, overcoming the Cassandra curse, right? Cassandra was this priestess from Greek mythology who was blessed with foresight. She could see future disasters, but she was cursed that no one would believe her. And Cassandra's problem was essentially a problem of communication, that it wasn't possible for her to convince others that what she saw was going to happen. So they didn't change their behavior, and those tragedies came to pass. I think we can break the Cassandra curse by seeing what's necessary, by building confidence that we can change it. Because all too often people just assume it's going to go on the way it is. We can't change things, especially groups that have been marginalized historically. and then by communicating effectively. And part of that means stronger alliances. There are always going to be powerful groups opposed to what public health wants to do. But let's take a page out of Coke and Pepsi,
Hmm.
right? They hate each other, but they get together to block soda taxes. We can work with many groups in public health, whether it's insurers or parents or organizations, find champions who can make a huge difference in parliaments and legislatures. We can create those alliances. It may not be quick, it may not be simple, but we identify what are the winnable battles, where can we make progress, and then how can we work strategically to do it.
And we have to assert a value proposition, don't we? Because we have to break that Cassandra curse. We have to assert a value proposition. So let me ask you, with regard to the CDC, how, if you had a broad audience, which you do have through this podcast, what's the value proposition that we need to assert to the public in the United States about why they should be supporting the CDC?
CDC works 24/7 to keep Americans safe, whether that's from infectious diseases or toxins or other threats, whether those are threats that arise in the US or anywhere in the world, whether those threats are naturally occurring or man made. And if the CDC is weaker, we are less safe.
And I think that some people have asserted or suggest that they've questioned the CDC's process for delivering their recommendations. As the former director, can you share with us how does the CDC come to recommendations? What's its final process from the science, the research, to its public assertions?
When I see some of the critiques of CDC, I'm really struck that look at what this administration is doing, not what they're saying. They're saying things like we want to rebuild trust in CDC, but everything they're doing is destroying the substantial trust that CDC had from people who understand public health and care about public health, whether it's doctors or organizations like the American Academy of Pediatrics or obstetricians. So when I was CDC director, I oversaw, for example, the Advisory Committee on Immunization Practices, and we had groups coming from all over the world to observe it because it is a best practice. Everything was transparent. There was no inappropriate pharmaceutical involvement in decisions. Now, I think one of the things it could have done better is explain its decisions because they were all done kind of very technically. So to say, okay, we're recommending this and this is why. Always when we make recommendations, we should say, this is what we're recommending and why. And this is what we know and don't know. This is how we know it. And based on what we know now, this is what we're recommending. So I think you can always do better, right? You can always improve processes. And one of the challenges is being clear with people that there is nuance. There are some judgment calls. And if there is a judgment call, we always want to maximize what individuals can do to decide what they want to do. But take a decision like recommending universal newborn vaccination against hepatitis B. This is a really important decision that has cut the number of infant and childhood hepatitis B vaccination infections down from 10 or 20,000 a year to 1 or 2,000 a year, a 90% reduction. And that's the kind of thing that those recommendations lead to that's so very important.
You and I met during the Ebola crisis when you were the head of the CDC, and the amazing people we worked with, and that were Americans working overseas, were putting their lives on the line to not only protect people afar, but also here at home. Can you share with us a little bit of your experience about the men and women who worked for you, what they did and why they did it in places far away from this country? And I think, frankly, downright heroic actions that most Americans will never ever see. Can you tell us a little bit about that?
Well, I remember one doctor who had been many months working on the front lines, and as you may remember, we didn't have as many French speakers as we needed, and we had a great collaboration with the Canadian public health groups, and they ended up supervising some of our own staff because they had more senior French speakers than we did. But one of our French speakers had been many, many months in Guinea, and I asked him, why are you doing this, basically? How do you feel about it? And I'll never forget what he said. He said, our parents talk about what they did in World War II. This is the big one for public health. And when my children or grandchildren asked me, what did I do during the Ebola epidemic? I want to be able to be proud of what we did. And we had so many creative people. Um, a couple of the terrific doctors at CDC worked for many months in Liberia, coming up with things like the rapid isolation and treatment of Ebola, RITE, right strategy. This was Frank Mahoney and Kim Lindblade. And what they did was figure out if they got there in just a few days rather than just a few weeks, they could stop the outbreak faster, and the outbreak would be stopped sooner, and the survival rates would double or triple for the people affected because they were able to be treated earlier. I remember at one point we had a mobile lab staffed by CDC staff, and I remember one of them was packing in like a trunk, and she was bringing the whole trunk with her to go to West Africa. And they worked every single day, including Thanksgiving and Christmas. I called them on those days and thanked them. They did 27,000 Ebola tests on all unsuspected patients without a slip, without a delay. They moved the lab when they needed to go to a new area. At one point, it was all female laboratory specialists, and they were really proud. They were doing more and faster than others. They called themselves Team Estrogen. There was a really, and has been a really great motivation, dedication, commitment. And recently, when I saw the CDC presentations to the Advisory Committee on Immunization Practices, the same super high quality, very clear, rigorous, deep knowledge, non-ideological. There's still thousands and thousands of people working at the CDC who go there for the privilege of doing work that they know protects Americans and save lives.
And I think it's important as you outline that, Tom, that the recommendations that come up from the CDC are based on research. They're not a rubber stamp for any political party or any political leader. And in fact, it is their responsibility to assert that message to the American public without political interference. And once politics gets involved in that, that can be really destructive to the health of Americans. Um,
I think it is important to be clear. CDC doesn't set broad policy. CDC does have very specific scientific technical recommendations on things like the vaccine schedule or levels of lead that require different levels of intervention. Those are technical issues. But on broader policy issues like, do we close businesses? That's a political decision. And the role of the CDC is to provide information so that policymakers can make those broader decisions, not to make those decisions itself.
And I think that the cuts, of course, as you mentioned, to the CDC, both in terms of money as well as individuals, is a real loss to the structure. It's very hard to build up. So if you were to strengthen the Centers for Disease Control and Prevention, what do you think in front of Congress, what would you ask them to do? What should they do? And what should Americans do to be able to have a stronger CDC?
Well, I think CDC does need a few things. Um, we can't go backwards. We have to go forward. And I think uh, when I joined CDC in 1990, there was an ethos that if a state or city or country requested assistance from CDC, you would be on a plane by sundown or someone else would be. And I think that speed, whether it's in responding or creating guidance or providing effective communication, that speed we need to get back to. CDC also needs to focus on impact. How do we have the maximum impact protecting and improving health? Needs to be better at communicating, listening, and conveying rapidly and in real time, and with stronger alliances, especially the connections nationally and internationally. At CDC, there are state and local health departments in the US. There's sometimes too much of a disconnect between the CDC and the state and local health departments. And that has to be more of a aligned enterprise. Globally, CDC has done some fantastic work. I particularly am inspired by the field epidemiology training programs, which have worked with thousands and thousands of epidemiologists around the world. But I think we need to ensure that in public health, we go from uh, kind of one model to a new model. And that new model is really an interdependent model where rather than teaching, we're learning together. And that's really important.
And the interdependence is important because a lot of people may see why should we be caring about that which is outside the borders of the United States? But public health is really dependent on, as you mentioned, an integrated global response. Can you share with us a little bit about if you were saying to the public why the CDC should be involved in challenges outside the borders of the US? What would you say to them in terms of the value proposition, not only from a health perspective, but also from an economic perspective?
Within the US, we emphasize that if countries are stronger there, we're safer here, that it's going to be more efficient, more effective, and better to stop outbreaks when and where they emerge rather than to have to deal with them when they're on our shores. Globally, I would say that we really can all learn from one another. Uh, in my career, when I became New York City Health Commissioner, because I had worked globally, I had learned a lot about how to set and achieve goals. When I worked in tuberculosis for a decade, I learned an enormous amount from the World Health Organization, from the KNCV and IUETLD, great organizations that had worked in TB for many years. So it's about getting the best knowledge from wherever you can get it to protect and improve health as much as possible. And that's what I've put into the book to try to share those lessons is that that's what I've put into the book to try to share the lessons that I've learned from mentors. And I will say that all proceeds from the book will go to groups and projects working for health around the world. None of it to me personally.
Well, that's incredibly generous, Dr. Frieden, but it's certainly keeping with what you've been doing your entire life. And if I can shift a little bit to what you have done for the last few years since you left the CDC, which aligns really well with the CDC, you are the founder and CEO of Resolve to Save Lives, and that's not only deals with infectious diseases, but also that bucket of non-communicable diseases that are responsible for 70% of deaths and the leading cause of disability worldwide. So can you tell us a little bit about what is Resolve, what does it do, and why did you start it?
Resolve to Save Lives partners locally and globally to co-create and scale solutions to the world's deadliest health threats. Since 2017, the past 8 years, we've worked with governments, universities, and other partners in more than 60 countries. And the programs that these countries have done will prevent millions of deaths from cardiovascular disease, will prevent and have prevented epidemics, and are addressing other leading health threats. So, some of the things that we've done is to work in the epidemic prevention space. For example, partnering with countries to increase the ability of these country systems to find outbreaks faster and stop them sooner through everything from management training to better information systems to a target called 717, where every outbreak is found within 7 days, reported to public health within 1 day, and all essential control measures in place within 7 days. And with 717, it really is possible to use every outbreak as a learning experience to figure out what went well, what didn't, what can we fix in the short term, what do we need to work on in the longer term. And now nearly 50 countries, along with WHO, the World Bank, the Pandemic Fund, the Global Fund, and many other entities are using the 717 approach because they're finding that it's a way of going from a slow improvement to a fast improvement. It accelerates preparedness improvements. It gives some advocacy numbers to advocate for more resources, and it gives accountability for donors to say, hey, it used to be we were 25% 717, now we're at 40%, and we can get to 60% if we can get this. So I think it's an important way to build accountability in public health. In the cardiovascular space, we've worked with more than 50 countries to support them to pass bans on artificial trans fat. This is a toxic chemical added to food supply that was estimated in the past to kill 500,000 people a year. The model now, with more than 4 billion people protected, is that this will prevent at least 9 million deaths in the coming years. And we're working to scale up prevention and treatment of high blood pressure. High blood pressure is the world's leading cause of death. It kills about 11 million people a year, and uh, the majority of them are in low and middle income countries, and a very high proportion
Mm.
are at a young age. And it's quite preventable and quite treatable for as little as $5 a year. But we need to scale up those systems to make it work.
And you were part of a new report that just came out on hypertension with the WHO. Did you want to share a little bit about that?
Yeah, what this report shows is that there are about 1.4 billion people in the world with hypertension. More than a billion of them don't have their blood pressure controlled. And this means that every second of every day, a billion hearts are beating in ways that are damaging hearts and brains and kidneys and increasing the risk for heart attack, stroke, dementia, kidney failure. But there are some success stories. There are countries as varied as Costa Rica and um, South Korea that have scaled up treatment very effectively. And the data from South Korea is really stunning. They've seen a dramatic reduction in heart attacks and strokes with this increase in hypertension control.
Low cost, high impact, the beauty of public health in play. Before I Yeah. Before I turn it over to you, Tom, for last words, you know, obviously you've been extremely effective at getting something that we at the Consortium of Universities for Global Health have been trying to do for a while, is that bringing in the players we don't normally have at the table, that is politicians in the private sector, because we've got to get political commitment and we need the money. Can you share with our viewers? What's the magic sauce? How did you manage to be able to bring in and secure the political commitment that is essential to liberating the support as well as the funding and the people to be able to implement and sustain the programs that are underpinning what you're doing?
There's no simple answer to that. It's why I wrote the book, The Formula for Better Health, because I do think we look for the windows of opportunity. It may be that there's an elected leader who cares very much about public health, as Mike Bloomberg did in New York City. The country of Chile had a legislator who was very focused on food and nutrition. And he really was one of the driving forces behind the Chile style stop sign
Mm,
warnings on the front of pack that are now spreading all over the world. So
mm,
champions and individuals can make a really big difference. But reading the room carefully, reading the environment carefully. I talk in the book about it's sloppy thinking to say there's not enough political will. We need to analyze that. We're epidemiologists. We need to analyze who are the winners and who are the losers in any initiative. How can we empower the winners and mitigate the opposition of the losers? Who are the deciders and who are the influencers? And how can we get to those people? Maybe someone's friends with or has known for a long time someone who's going to make a decision or influence someone to make a decision. Who are the advocates and champions? And what are the partnerships that will make a difference? And what's the timing and what are the pragmatic aspects? When does budget period start? When is there a goal for a new program? When I was in New York City, I suddenly realized that when re-election season came around, it was time for promises, and promises
mm.
came with money. And so we proposed a program to provide prevention-oriented electronic health records for people in the South Bronx, Central Harlem, and Bedford-Stuyvesant, the three poorest, sickest neighborhoods of New York City. And we got tens of millions of dollars and people got better care in those areas. I'll leave you with one story. When I was running the tuberculosis program in New York City, we had fought for years to get money for the clinics to get renovated because they were in terrible shape. They were filthy, they were unsafe, they were just depressing to work in, and I worked in them as a clinician, volunteering my time. And with great effort, we had gotten the administration of Mayor David Dinkins to commit millions of dollars to renovate the clinics. And then Mayor Rudy Giuliani came in And we were really afraid we were going to lose the clinics. A letter came to the mayor from the New York Coalition to Eliminate Tuberculosis, demanding that the clinic renovations proceed. That letter sifted down to me as the assistant commissioner to draft a reply. I didn't know what to say. It was the first week of the administration, so I drafted kind of a mealy-mouthed reply and sent it back up. And it went back up, came back from the mayor's office saying, no, tell them we're going to renovate those clinics. And that letter saved our clinics. Now, the New York Coalition to Eliminate Tuberculosis, that letter was written on a manual typewriter by a man named Charles Ehlers, who was a cured tuberculosis patient. And in fact, the New York Coalition to Eliminate Tuberculosis was Charles Ehlers. There was no organization. It was just him with a letterhead writing that letter. So people, individuals really can make a difference. And when we work with others, we can make an even bigger difference.
Well, that's a great way to end this, Tom. The power of one can be amplified to the power of many, and public health is the enormous bang for the buck to be able to improve people's lives here and around the world. Dr. Tom Frieden, the former director of the Centers for Disease Control and Prevention, thank you for what you've been doing. Thank you for sharing your views about the CDC and public health and how we can actually build forward better to make this world a healthier place, which is our common objective. It's been a real privilege to talk to you.
Thank you, Keith. And I want to thank all of your listeners and all of the partners here because what the universities do to create the next generation of public health leaders is really the most important thing. Can we support people, mentor people, connect people with meaningful work where we're constantly learning, enjoying the work with others? And what could be a greater privilege than work that saves lives?
100%, isn't that? That's the a core of a deeply meaningful life, and working with wonderful people who share that. Isn't that the case?
Absolutely. Thank you so much.
Tom, thanks very much. And thank you everybody for listening to Dr. Tom Frieden. We certainly hope that this and fully support, obviously, the men and women who work for the Centers for Disease Control and Prevention. They, in my view, are heroes, and they stand on guard, as Dr. Frieden said, 24/7 to improve and save the lives of people in the United States and around the world. And they do it with a very minimal amount of money with huge impact. And as we move forward to build forward better, to make and build a healthier America, public health is a core pillar of that effort. And we all need to get behind to not only support what we've had, but to strengthen that, because without it, we're not going to have a healthier, stronger, or secure world. So thank you for joining us. And I would encourage you to come to our virtual Global Health Week. It's free for everybody, December 2nd to 4th, as well as our conference, which will be in Washington, D.C. Next April 9th to the 12th. You're all invited to come. And again, thank you very much for attending the Global Health Leader Series.